feels so tight that I can't take deep breaths. Yeah.
Welcome to the scoliosis.
Yeah.
We're a scoliosis team. It'll be
Yay.
all right by keeping your middle back moving
Okay.
and cleaning up the,
Yeah, because it doesn't move.
Well, we'll see. I'll get it. There we go. You all right?
Yeah, it's never done that.
Okay.
When anyone's ever done that.
It's kind of the best.
Even just now, just like breathing
Yeah. It'll get easier.
is a lot easier than it was before.
awesome.
Yeah. I'm like, oh, deep breath, and like real air.
They're just,
Oh.
you do not have a rod in your back. Do you have a rod in your back?
No.
You don't? Okay.
No.
If you had a rod in your back, I'll shut up. Okay? But you don't have a rod in your back. Nobody surgically fused you, right? You have knuckles. I felt them. Okay? And what are knuckles designed to do? Bend. You've had scoliosis since you said from pretty young.
Yeah.
I just told you I had I have a 19 degree, what we call dextro-levo. So dextro means to the right. So mine goes to the right in the thoracic.
Okay.
And then the left, levo left on the lumbar. The heart's on the left, so it usually always goes away from the heart. That's
Okay.
where if I actually look at the pictures, you'd actually see it bend. Like if your heart's right about here, it would go away from it. You don't really ever see a left in the thoracic, at least where the heart is. It happens during the growth years, what we call structural scoliosis. They happen because your brain is up here, and then the spinal cord obviously attached to your brain, and that's attached down to the coccyx down here. So the distance between our brain and our tailbone is growing, but the bones can grow faster than the cord inside. And if you ever have like somebody going down a street and they cut that corner, they don't want to go all the way around like a bend. They kind of skirt the edge. Does that make sense? That's what the spinal cord does. By the column, takes a longer path. Does that make sense? And then the cord rides the inside road.
Got it.
Make sense? It's essentially our spinal cord is not long enough. That's what creates and nobody told you that, I know, but that's
Fantastic.
That's essentially why it happens. That's why ultimately, when I've tried to get my scoliosis less than 19 degrees, what ends up starting to happening, and they've done this with MRIs, the cord starts to tether the brain down into the neck. So we call it cord tethering. If you take an MRI, you'd actually see, like if you say, put my spine straight and put rods in here to force it to be straight, the actual brain start to get pulled into my neck, causing constant headaches.
So don't they do that for some?
It's not, well, it depends. If it's a structural scoliosis, it's really not good that they're doing that.
Got it. Okay.
Like you're causing more problems than even the scoliosis would have created. And the difficulty with scoliosis, and the main thing you need to understand with scoliosis, is that I've been practicing for 18 years. My dad's been practicing for 40 years. If I had to give you my top 10, top 50 worst patients in my office, none of them have scoliosis. The scoliosis is not to be demonized, as much as I know our world loves to pick on it. We actually have, ultimately, I know on your MRI, you have an MRI here, and I'll go over this in a second. They mention annular tears, annular bulge. We're talking about the middle back here. These disc injury, let's back up and go. What are you feeling? Let's start with that before I go to this.
I
Pain
have
there?
right here, and I've had pain right in my mid back. I can pinpoint exactly where it's at. It's right here. And anytime I go to like pain management or doctors, they just say, sit up straighter, lose weight, which I did.
Right.
I did all that. I had lost 140 pounds. Guess what? It still hurts.
Yeah.
I had the pain even before I was heavy.
Yeah.
And they just say, have you tried ibuprofen?
Sure.
I can't take ibuprofen. They just say, well, it's not the scoliosis. And I'm like, okay, well, what is it then?
I'll give you the answer in a second.
And so I've just had that pain, and it just hurts so bad that...
Sharp.
One spot. Today it's burning.
Okay.
And it's that one spot.
Yeah.
I mean, I have pain here, obviously. Like, I know my posture's not the greatest, and I do have that pain there, but if this would just calm down,
We'll fix it.
I'd be so much better.
We'll fix it. It's the joint capsule. So it's called facet syndrome. You're actually pointing directly over the facet, the joint in there, and it's because of the scoliosis. So one of the crimes that we have with the scoliosis, we call it the high side of the rainbow. So get the idea? If it was a rainbow, on the high side, these joints, so this side is going to be jammed. You understand? The left side is going to be squeezed together. The right side is going to be expanded open, and it swells up. And that's what you're feeling in there is essentially a swollen facet, a swollen joint because of the alignment that you're in.
Mm-hmm.
Now, that pain has nothing to do with what is described on your MRI. They talk about annular tears. That would give you a different symptom than that.
Okay.
They're there, and I don't ever think those injuries on here will ever cause any consequence at all and never bother you, or it won't be anything a medical doctor will even pay attention to anyway. What this ultimately will cause is the lower back, right? L5, L4, down here in the lower back. My right lower back, I know, is where I like to stand. When you catch me, I like to do this. It's how I like to stand. This, not as comfortable. Do you understand?
A little awkward.
A little more awkward.
Yeah.
And we probably have a similar to me. We like to stand on our right leg because that feeds that scoliosis. We like to stand with this popped out.
Okay.
That's why this is all swollen on the right, is because of the laterality. But ultimately that pain is simply the knuckles. They're just the joints in there, and they have loud voices. It's like having we call it like a tendonitis or an epicondylitis. You have these microscopic injuries that are like, I can't lift my arm up, you understand? Or periosteal pains. The joint capsule is so loaded with pain fibers, like a rib head, that we take pictures, we can't even see it, but I'm dying here. And it's actually not too difficult to fix that. There's probably a lot of lactic acid, so we're gonna wash all that area.
Okay.
We're gonna see a large amount of those dark marks. And then Epsom salt this evening.
Okay.
We'll see if we can get some. The faster that mark goes away, we'll go right over it. You'll see a huge. The area is so swollen that the joint capsule starts to leak some of the inflammation into the surrounding tissue. That's what then causes that burning. So you have that sharp pain, and then the burning is the actual local area being upset. It's the alignment that creates it. What I brought over here was a device called a Scoli roll. Mm-hmm. And we can start with a roller, like a black foam roller, but we're going to try to lay on our side, and we're going to try to compress that joint with some level of low. Try not to go too crazy. We'll start at a lower level, but we got to start trying to show you after we clean it how to clean it yourself. Okay. I feel it right even when I'm standing. I can feel a little mild.
Really?
It's on the high side of the rainbow, but now I clean mine. And you have to teach you how to clean it. Okay. It's going to be okay. It's not going to be, it is very painful because the joint capsule is so loaded with pain fibers. These discs actually have no pain fibers. You can't actually feel annular tears. The disc hits the nerve, and if that nerve was being hit, you'd feel it wrapping around. And the joint capsule can irritate that nerve a little bit too. So if there is some wrapping around, I would still blame it on the joint capsule.
Yeah, I've never had with that.
That would be
just when I breathe.
You take a deep breath in, you feel it.
It feels so tight that I can't take deep breaths. So I can't I can't go any further than that.
I know. When I take a deep breath in, I get a little.
Yeah.
Welcome to the scoliosis.
Yeah.
We're a scoliosis team. It'll be all right. It's okay.
Yay.
But again, it's not something that really anybody really cares about what you've already been through. You understand? They don't really get out of here. Here's some prednisone. Here's some muscle relaxants.
Yep.
It's not a disc injury at L5 where they want to do a lumbar discectomy or a surgery or limbectomy.
I've had epidural injections.
No, won't work.
That didn't work. I've had nerve ablations. Doesn't work. Just makes my back feel a little numb. And then I kind of stopped going to pain management because I was like, it's not actually doing
those areas
anything.
Are so loaded with pain fibers that even if you fry them with radio frequency, they just regrow.
Yeah, I was like,
it's too sensitive in an area.
And then they just kept trying to prescribe me NSAIDs, and I'm like, I can't take these. I was like, you guys don't listen.
We'll fix you up. It won't be that mild facet arthrosis at L4, L5. That right there is what we need to. That's going to be your main guy.
Okay.
That's everything else on here. I almost don't even think to be significant. All this right here,
Okay.
That would be if you want to worry about something. When that joint. That means the joint is growing. Is basically what that means. The knuckle is growing. Because of that laterality, there's some torque going on down here that shouldn't be there, and that growth of that joint, we want to try to slow that down by keeping your middle back moving and cleaning up the,
Yeah, because it doesn't move.
Well, we'll see. I'll get it. That's my job.
Have you tried chiropractic before?
Yes, because what happens is if I go like this,
Sure.
It feels like it needs to pop,
right?
But it doesn't pop. So anytime you say that to a doctor, they're like, "Oh, go see a chiropractor," and I'm like, "Okay," but the problem is there's a lot of bad chiropractors. And then the most recent one I saw, like, would do the thing where you lay down and, like, hug. And I just was so stiff, and they wouldn't, like, and they just did it, and it hurt worse when I left. And I was like, fantastic.
Did it move, or, okay.
So the joints,
a little bit.
The joints are going to be uncomfortable being squeezed, right? So, but we're going to use the soft tissue work to help make it easier to be able to be adjusted. We'll do some light adjustments first, but many times we tilt forward and hunch to get away from the joints. But that just makes the joints swell up more, and then when you try to, it's what makes it feel like it needs to pop more. So we can't avoid it. It needs to be confronted, but in confronting it, we're going to feel it more. So hang in there with me as we bring your body upright, and as we, don't let you slouch and round forward. Maybe stand for me, face to the right. I'm going to look at your posture here. Just relax your arms by your side. There we go. Yeah, left shoulder. It's me. You got it. It's looking at myself.
Looking in a mirror.
Looking in a mirror myself. Yeah, right hip is high. Okay. Right. Any pain when you turn your neck left or right? Right. Restricted to the left.
It's just like a little tight, but.
So part of it is when we part of the scoliosis is because our spine can only have so much curve in it at one time. And so when we lose curve in one place, we get additional curve elsewhere. So we're supposed to have this front to back neck curve. Your head's gone forward, which means the loss of curve here has created an accentuated, do you understand, curve here. Mm-hmm. And so to get the curve back into your neck, we have to remove it from the kyphosis of the upper back, right? And then to some degree also, the structural curve that formed when you're a teenager can be fed to be larger by the loss of neck curve. And so you'll see me rubbing your neck and working your neck, and you're like, well, doc, it's down here in my back. Why are you rubbing my neck so much? Because the more curve that I get in your neck, the less this will go away, right? It's like trading a currency. We're going to trade some of the excessive curve from the upper back. We have to induce it into the neck.
Okay.
Bend both the knees for me. I'm just going to see how your back's moving. Deep breath in, a little sit up. I'm going to help you. Deep breath in, go real gentle. Exhale, just relax your back. I got you. Real gentle, I got you. Yeah, deep breath, I got you. Okay, I got you. Exhale, let it go. I got you. I got you. Come on. Deep breath, one more time. I'm not going to hurt you. I got you. Exhale. So, okay. There we go. Deep breath in. I got you. Be great. I know it's tough. I got you. It's okay. Exhale. I got you. Okay. All right. You all right?
Yeah, it's never done that.
Okay.
When anyone's ever done that.
It's kind of the best.
So it looked like it was a little painful.
It's going to be painful.
Uncomfortable?
Yes, a little bit.
Yeah.
But now it's fine.
Yeah.
Okay.
It's okay. Capsules are loaded with pain fibers. They need to be compressed to help them feel better when they're not being adjusted. You have to squeeze out. When I'm adjusting my upper back, I don't like it either. I get adjusted 5 times a week.
Okay.
I'm just saying, it's not like I've been adjusted, 5,000 times in the last 18 years. It's not like that's ever easy for me either.
Okay.
You understand? It won't ever be like something like when my dad adjusted me, it's like, oh, here it comes. Because those joints are, especially on the right side, are going to be more swollen than a person that doesn't have a scoliosis has.
Okay.
We need to manage it. We have to be taught how to clean that area. And I would say it's a 1 or 2 out of 10, but I always feel something in there that I don't think a non-scoliosis patient will feel. It's okay. You're just like, it's going to be much higher when it's swollen.
Okay.
There you go. There you go. Oh, there it is. You okay? Yeah. We're not trying to move every bone, right? We're just trying to move the upper neck a little bit. The tenderness, a majority of it is because of the alignment of your head to shoulders, right?
Okay.
The head is forward from your shoulder, so the muscles here are working much, much harder than they're supposed to be all the time. I got you. A little gentle. I got you. There you go. I'm the best, I know. This is all popped out, let's call it, right? This is all pushed out. This should be like sort of sunken in. Does that make sense? The neck should feel like this dips inwards.
Okay.
When you tuck your chin down, the bones all slide, what we call posterior.
Mm-hmm.
When our neck is curved, the vertebrae go towards the front. So your normal static position, like this knot shouldn't be here.
Oh.
All this being pushed out is the wrong alignment. And it's a piece of the puzzle for even what's going on in your chest. You understand? It's not separate, it's connected. This loss of curve in the neck is further adding to the burden that the chest is having to deal with, and the knuckles and joints in there having to. And that's what I was saying earlier, we got to work on getting your neck, you follow me, back
like
to
that.
being curved. the more I spend time with my chin down, the more I'll feel pain in my middle back.
Okay.
Because the middle back is ultimately the roots of your neck. And so when I look at you from the side, the alignment that you're in is keeping, it's like a multiplication modifier on the stress that the middle back is having to undertake. As chiropractors, and maybe you've been through this if you've worked for one, you know I probably fall prey to it. I know my sister and brother, we all get so focused on the pops. And the pops are cool, and they feel good, but it's really not what I want. What I want is your back to feel soft. You follow me?
Okay.
Whether it cracks or not is irrelevant.
Mm-hmm.
It's really, if somebody's back can actually move. You understand? Everything moves, and there just not be any air bubbles in the joints, and we don't feel any clicks. Does that make sense? But it's not like that was a bad adjustment. The joints still moved. The flexibility is there. You're ready for stretching.
Got it.
So just be aware a little bit of that. It isn't, it's not like end all be all. I got to see how many pops I can get out of your back. Don't fall down that road. Right there. These are the roots of your neck.
Oh yeah, those are crunchy.
Yeah. All right. There you go. We'll get you fixed up. I felt stiffer back then. Don't worry. You're not even in my top 1,000.
Perfect.
You understand? Stiffest backs. I've had people with no scoliosis, and I go to adjust their back, and it's like I'm out there in the parking lot pushing on concrete. You understand? You do not have a concrete back. You just have some swollen joints in there that need to be cleaned. They're like 2-year-olds. They scream and cry over the smallest little things. You
My
understand?
4-year-old, yes.
Right. It's like the end of the world every time they can't
Yes.
do anything. That's a joint. Okay, the joints in your back are like kids.
I will say, having one toddler
Mhm.
made me only have
Mhm.
one toddler.
Right.
So kudos to you guys.
The other day I was like, when we were dealing with our 5-year-old, I was like, Carl, in our marriage, we've always had a 5-year-old. We've just transferred who's the 5-year-old.
Right. There's always one turning 5 or coming up to 5.
It's always been a 5-year-old.
We've always had the same, our last one.
Anyone who has more than one, I'm like, good for you.
Mhm.
I'm proud of you, but no thank you.
Thank you.
Yeah.
You ever see the Enchanted movie? You ever see Enchanted?
Yes.
Where the squirrel's talking to he's trying to describe something, I've been dreaming of a child loves kids. Apple? No thank you.
That's pretty much my husband because
It's
he wanted another one.
Yes.
And then as soon as she got to be about 1.5, 2, he's like, no, absolutely not.
Real gentle, just see if there's any more. I got you, I'm not gonna hurt you. There you go. There you go. You all right?
Mm-hmm.
Get the idea of what that was? That was the same joint moving again. The first adjustment, the joint moved halfway, and then I took it a little bit farther, right?
Okay.
Now, why is that important? Why do we need to get the joints to come together and to overlap? That's to help get the stretching to be effective. Because if the joints won't compress, then we can't stretch the ligaments to get the curve back in your neck.
Okay.
It makes sense.
Yes.
It'll make more sense in a second. But that's the whole purpose of why we have to get the weight onto the joints, off the disc, so we can stretch the ligament so that posture change actually works. I got you. Okay, a little tap here on this right side. Let it go here. There it is. Good. Very good. All right, we'll get you cleaned up. Start with the easy side. I know. Don't go to the right side, Ed. I've had firefighters come in here, and they can't even lay face down on my table, right? It's too painful. The table holds you upright. You understand? Part of what can happen is you lay face down on my table, you're like, your headpiece is very uncomfortable. Well, no, the headpiece is holding your head back. You follow me?
Yeah.
The table's not letting you hunch forward. And if your body wants to be hunched forward, laying face down on my table will be very uncomfortable. And so I've had people with such bad spinal problems that when they lay face down, they can't hunch forward, and therefore they can't stand it. But all in here, a lot of mouths to feed. There's 12 vertebrae in your thoracic cage, right? And then 4 joints at every level, right? 2 facets between the vertebrae, and then 2 rib heads on the side, right? So you have 48 joints, right? It's a lot of knuckles. It's a lot of mouths to feed in just the thoracic cage. And it's exactly what I just said. It's a cage. It's a prison. It tends to not want to move. Get the idea, right?
Mm-hmm.
Because its purpose is what? To protect your organs,
Yeah.
right? And so there's a level of self-care care that's required to maintain flexibility in the prison, in the caged area that we should have been taught from a young age. The mobility of the vertebrae is what keeps it clean. So because not only do you have a cage, but you have a laterality, right? Now you have this extra component that is going to make the area prone to stiffness, build up with lactic acid, inflammation, the joint pain that we're describing.
Okay.
Yeah, I know. Okay. Just fix me head. Okay. Cost double if you want me to be quiet.
It makes sense though.
There we go. But yeah, I feel right in here something. This is some sort of minor compared to the right, but there's a little
I can feel
bit
it.
right in there.
Yeah.
Let me clean that up. The gua sha is a remarkable tool for helping this. This is where anybody can really go online and get a gua sha tool. You kind of just get some oil, or you know, rub the area a little bit first, and then, you know, one day your husband comes in here, I can show him, or you can buy a gua sha manual, and you just comb right over it, right?
What does that do exactly?
All right, so the gua sha is you're just combing the tissue, which brings a lot of blood into the area, right? And what does blood do? Well, blood carries what? Oxygen. An area that's been contracted for a long period of time builds up metabolic waste called lactic acid, right? Your body, pyruvate, Krebs cycle, glycolysis, right? You get, at the end of it is lactic acid. Oxygen binds to lactic acid and converts it to carbon dioxide and water. If the lactic acid accumulates in the tissue to a significant amount, that causes pain. It's acid. So the nerve that's in the area is going to be inflamed due to the accumulation of lactic acid. By bringing oxygen into the tissue, you bind to lactic acid, convert it from lactic acid to, the effect is that you get carbon dioxide and water. And so the carbon dioxide is exchanged with the oxygen, you exhale the carbon dioxide, and the water is absorbed by the tissue. Yay! But because the area is so stiff, the ability for perfusion, the ability for oxygen to get into the tissue is limited. It's like the top of Mount Everest, right? It's not a very high traffic area. So we have to make the area more accessible by getting the posture better. Understand? Getting a bunch of Sherpas to bring oxygen up there. We're going to bring blood into an area that's not a very high traffic area. And right in here, yep. You all right?
Yep. As long as you keep talking.
Okay, all right. Keep yakking. You gotta work all that out of there.
Yep, that's exactly where it.
And again, we're not trying to just kill you, okay? If I'm going too hard, I don't need to. Over a handful of visits, we would progress through this, and we get to a place where, Ed, are you pushing with the same level of pressure that you used to? And this becomes easier and easier.
Okay.
This is not going to always remain this way. It will get better. The knuckles scream loud. They're like they're little 4-year-old, 5-year-olds, just whiny kids. It's like leaving love bugs on the paint of your car. Just eats the weight of the paint. You follow me? The acidity, or bird poop, whatever. You understand? It eats away at the wax and the paint. That's what lactic acid does to the joints and the nerves that are in the area.
So how does inflammation work? Like, does that you just have inflammation?
Inflammation is a tool that your body uses to repair damaged tissue, right? So because of the stress of the area, mechanically, there's been microscopic little injuries to the joints and the bones, you understand? Mm-hmm. And then the inflammation it's like if I get punched in my face swells up, right? Mm-hmm. Injecting cortisone shots is not going to stop me from being punched in the face every day. So therefore the inflammation can't go away. The only way for my face not to be swollen is to stop the punching. Your posture is what's creating the punching.
Got it.
The head being forward, the loss of curve, the hunch in your upper back, the laterality to some degree that we can't completely remove. This area is going to be punched a little bit. Now it's going to be punched less, but I can't completely stop the punching. Okay. So that's why I'm saying we have to learn how to rinse out some of the inflammation, and it'll be manageable. And it won't be so out of control. There's another component which is, I don't even talk about this one. So you are what you eat kind of idea, right? The foods that we eat are made up of what we call omega-3s and omega-6s, right? Mm-hmm. And you'll have people go down this long rabbit trail of You need more EPA, DHA, omega-3s, and the junk food that we all know is junk food is loaded with omega-6s. What are omega-3s and omega-6s? They're basically the precursors for what we call arachidonic acid or alpha-linolenic acid. And so if your body's filled with omega-6s, when there's tissue damage, your body reacts in a high inflammatory way. If your body has a lot of omega-3s, when we have tissue damage, your body does not react in a high inflammatory way. So how overt the inflammatory response is based on your diet. You catch me? Mm-hmm. Right? So if your diet's Chick-fil-A and burgers, does that make sense? Then your body's going to react even to a small level of injury at a high level of pain. And so there are a lot of chiropractors, and my gosh, I had them at my school almost to the point where they ignore what chiropractic should be, and that's all they focus on is this omega-3 to 6 ratio. Maybe you've heard about this stuff, right? No, a little bit. Omega-3s? No? This is what's in fish oils. We call them fish oils, and the foods that we know are good are loaded with omega-3s. And it becomes, like I said, I'm not saying it's not important, but it's my gosh, it's all, if you start bringing it up, it's like all you hear about from certain doctors is the omega-3 6 ratio. You're supposed to be about 4 to 1, 4 to 6s for every 1 3 is what they say, and most Americans are about 40 to 1 or close to 100 to 1. They're way too much omega-6s, and so their bodies react in a very overt inflammatory manner when there's any type of injury. So take that for what it's worth. Epsom salt bath is going to be, you have the ability to soak now?
Yes.
Okay. Would love a couple cups, 15, 20 minutes, just soak this evening. Tomorrow morning is going to be pretty sore. Don't be, no angry phone calls. It's going to be a little sore. It'll feel better in a few days once these marks go away that I haven't even made yet, but I can already feel what's inside here is going to pour out.
Okay.
All right.
Are you doing okay with the pressure?
Yeah.
Okay.
You're doing good.
Baths are fun because I'm 5'10". I don't really fit in bathtubs very well, but I will definitely. Plus, I've been this height since I was like 13,
Mm-hmm.
and all my friends were like 5'2".
Right. That's why you have scoliosis. Your back, your bones grew much faster than your cord could grow. And that's nerves can only grow so fast, but you had this growth spurt that was so quick.
Yeah.
You're doing good right there, yeah.
Yeah, it feels very crunchy.
Yeah, right in here. Yeah, I mean, it's pretty clear where you're hurting, because where you're not hurting is not really marking up. It only comes out where, and we'll show you on the right side in a second. Hello. Yeah, right there. Learning how to floss your back, learning how to water pick and clean this pocket in here. Showing your husband how to just, lay down, and then giving you tools that you can manually, put on there with a level of specificity that will help you have tools when you're by yourself to do it.
That's unpleasant.
Okay. And we're good.
I like your sarcasm.
Okay. There we go. All right.
Yes.
Okay. You're doing good. Here we go. How bad is that? You okay?
Yeah.
Pretty bad?
No.
Okay. All right. We'll do it this way. I'm just going to stretch for a second. I'm just going to stretch. Breathe. You okay?
Mm-hmm.
Breathe. Lay on your back. I got you. Relax. Relax your leg. There we go.
Never had that done.
You're a good sport.
Weird.
Go ahead and tilt your head left for me. Tilt left. Go ahead and tilt left. Okay.
It's different.
Sometimes we'll get a little quicker here. Go ahead and tilt right. And then go ahead and tilt to the right for me.
That's kind of weird.
Come on over here. Okay. There we go. I know. Arms to the side. Over here. There you go. There you go. Okay, we have to start somewhere, okay? Because everybody's got a starting point. I'm just gonna find your starting point. I'm examining, right? We're examining and treating. I'm trying to see how deep can I push you? We have to stretch in intervals of 20 minutes. It is not to say that 5 minutes is not beneficial, but only insofar as it helps you get to 20 minutes. The ligaments on the front need to be held. The fabric on the front of your body has to be held for about 20 minutes to make a permanent change. We have to start compressing over that spot that you love so much. And to achieve that and to not overwhelm you, we need to put something behind your head to limit the depth. I don't care if it's easy. I don't care if you, Ed, I feel like it's not doing anything. Good, start off there. We always can make it more intense and more painful, right? So let's not overwhelm you. Let's find some beginning place to go, okay? You're gonna roll upwards. You push with your feet and roll. I'm gonna help you. Keep roll upwards, yep. We're gonna move down your back. Keep your butt on the ground and stay there. Get the idea? And you're gonna start moving down until that roller's right over that rib. What do you think? We're there? You okay?
Yep. There it is.
Yep. And this is your homework, okay? Is it too overwhelming? Almost?
I mean, a little bit, but not.
Well, then run away. You run away a little bit. Run away. Let's go right. Go above it. You understand?
Okay.
Just run away.
Okay.
All right. You don't always have to be right on it. You're gonna attack. Do it for 30 seconds. Ed, I'm about ready to vomit. You run away. You understand? And then the more you do it, Ed, I can stay on it for 2 minutes. You follow me? And you're gonna be able to go longer and longer until Ed, I did 20 minutes just on that one spot. Right? That's our goal. These are goals that we're gonna have.
Okay.
Ed, I had 8 inches of books by my head. Now I have 6 inches of books by my head. Okay? Somebody should have been coaching you through this. You're saying this is a process of undoing and untangling your back. And the only way for there to be a significant or any type of permanent change is only in intervals of 20 minutes. If we're not getting it in 20 minutes, you will not see any difference the next time you do it.
Okay.
Catch me? So if you do this one time, now it might be harder the next day because this is the first time we're stretching, right? If you go to the gym and you've never worked out and the big workout that you do, the next day you might say, I'm weaker. Going to the gym makes people weaker. Well, no, you're out of shape and you just tore up your muscles and now you're sore, right? Get the idea?
Yeah.
So don't be disheartened. In the first week or two, there's a level of going up and down a little bit, but you're going to be trending upwards in terms of the improvement of the mobility of that area. Okay? But you can't zoom in too far. You have to zoom out like a stock market to see the global trending. You understand? If we're too zoomed in, you're like, well, I think I'm stiffer and it's more painful. And then you kind of try to go down and attack it. So roll upwards. Let's try to attack it. And then stay on it for too much.
No.
I'm here to be your cheerleader, and you understand, you got this. You're not going to hurt your back. It's going to hurt, but you're not going to hurt it. Okay? I promise you, you're not going to hurt your back rolling your back.
So when I can't get up, then I call you to come pick me up?
That's fine. And I need a forklift to get me off this thing.
Right? Like,
Roll back the way you came. Roll down.
That's a good
roll
question.
Right.
Don't do it unless your husband's home. So that is actually a valid question. So
because there are times that, like, I mean, I can get up, but
it's hard.
it's like, wait a second.
Yeah, you got it. Yeah. Breathe. Little vodka. Exactly. And just, You gotta have to just bear.
That's what you should do.
How did you know my nightly routine?
Gonna have to just leave Mama alone while she stretches her back over here. I know. Kicks your butt. I know. You gotta work on
Yes, it does.
arching back, and then then go on the way. And then what I'm saying with your belly, the tummy time, is you practice. You know, when you're on your phone, you gotta practice. You go ahead, please. Yep. Land it. Put your belly. You hug this. You hug that. There you go. You get the idea? And you gotta start practicing. Now, you don't have, if it's too painful, don't go so high. Come down a little lower.
Okay.
Get the idea? And you're interweaving this type of, gotta practice, letting it be okay. And then yes. Yes. This is when you're done. You're saying you're going to take this arm and you're stretching. See, I'm taking the opposite. My spine wants to go like this. I'm taking it to the opposite, and then we try to hold this for 20 minutes. Now, this is not comfortable for me either.
Okay.
You're saying this is not going to be comfortable.
I was like, I think that might kill me.
But it's going to be doable. It's going to be manageable.
Okay.
You follow me? And that's when I don't need to see you as much anymore. We're going to progress. Let me see the roller. Roller, eventually you're going to start like you're doing right now. You're on your back, and you're just going to attack the area with the head elevated until you can get your head down. You're doing these side to side, and eventually what you'll do is you'll do for like a minute or two. You'll try to go onto the right. So you can get her eyes. I promise you, it's not going to be.
I don't know if you felt how hard that roller is.
I know. No.
I have pillows.
Your back's going to become flexible. I promise you. You're not.
She's like, no.
You're going to bend. It's not going to bend. You are. Your back. Yes, it's a hard roller, but you're going to become flexible. I'm sorry. Shouldn't believe me. I promise you, it will.
That's where I draw the line, though.
Okay.
Apparently.
Well,
because it does not bend.
they're just.
No.
You do not have a rod in your back. Do you have a rod in your back?
No.
You don't. Okay.
No.
If you had a rod in your back, I'll shut up. Okay. But you don't have a rod in your back. Nobody surgically fused you, right? You have knuckles. I felt them. Okay. And what are knuckles designed to do? Bend. Right? Now you're showing me, Ed, I can't bend my fingers. I think I'm just going to live my life with straight fingers. See? Looks just fine. See? I don't need to bend my fingers. Bending your fingers is stupid. See?
That's how I've been living for 36 years, okay?
I can perform all my tasks with just straight fingers. No, joints are meant to bend, and your life's way better if we can get your joints to bend. But you're right, they're frozen, and you're only bending that far.
If I could do a back bend,
And we're gonna
that
go like
would
this.
make
We're
my
gonna-
life a whole lot better.
We're gonna go like this. Ah! Oh my gosh! Because they're designed to bend.
You guys are hilarious.
They're meant to bend. I'm not asking your joints to do something God didn't make them
You are
do.
hilarious.
Sorry, I don't.
He's like, my goal.
I won't
He's
give
like,
an inch.
I will
We'll
get
get
you
those
there.
joints.
It
They're-
will happen.
They're filled with pain fibers, and so the level of pain is ridiculous. And I'm sorry. The level of injury is small. It's like a cut on your lips. It's a little paper cut, and I'm freaking dying here. You understand? You have these tiny little cuts. We can't even see it. The images you have all they're seeing is the macro disc injury.
Yeah.
They're not even talking about the facets. There's arthrosis. I mean, it's very generic diagnosis. But if we had the Star Trek imaging, we could actually show you the inflammation and the bruising and all the nerve endings are in that joint capsule that are very upset.
Does that happen at the next appointment?
What is it?
Do I get that at the next one?
The
second appointment? Is that where we get the high-tech image?
I wish. I thought I grew up with Star Trek. I thought I was going to get Star Trek imaging. I was very disappointed when I became a doctor and they handed me X-rays and MRIs, and I was like,
Wait, this is what I have to work
"These
with?
are the tools that I have."
This is the best you got?
I wanted like what Beverly Crusher had. Zooming in, actually seeing the actual tendrils and the.
See, I like magic school bus.
Yeah.
Right.
In layers now, just like breathing
Yeah, it'll get easier.
is a lot easier than it was
That's
before.
awesome.
Yeah. I'm like, oh, deep breath. I'm like, real air.
Yeah, that's great.
Yeah.
No, that's life changing.
Thank you.
All right, you did great. All right, you'll be all right. All right,
All right, good
you're
job.
good.
Yes.